Hello everyone, I am a professional esthetician and cosmetologist. Thinking about Botox or fillers? You probably have questions, and that's normal. Today, I will answer the most common asked questions by people. No confusing jargon, just honest, detailed answers with respect to research and patients' outcomes. So watch complete video to get your every single query being answered in the best way. Subscribe my channel and hit the bell icon for more latest updates about trendy treatments. Section 1, Botox. Question 1, how long does Botox last? Botox typically lasts 3 to 4 months, but this varies. First-timers may see results fade faster, around 2 to 3 months, since their muscles are still strong. Regular users often get longer results, 4 to 6 months, because their muscles adapt. The area treated also matters. Forehead Botox may last differently than crow's feet. Your metabolism plays a role too, some people break it down quicker. Proper aftercare, avoiding exercise, heat for 24 hours, helps extend results. Question 2, does Botox make wrinkles worse if you stop? No. When Botox wears off, your face simply returns to how it was before treatment. Some people think wrinkles look worse because they got used to smooth skin, but Botox doesn't damage your skin or muscles. The wrinkles you see are just your natural ones reappearing. Long-term Botox may actually slow wrinkle formation by preventing repeated muscle contractions. Question 3, can Botox prevent wrinkles? Yes. Starting Botox early, late 20s to 30s, can stop wrinkles from forming. This is called preventive Botox. By relaxing muscles before deep lines develop, you prevent skin from creasing repeatedly. The best areas are forehead lines, frown lines, between eyebrows, and crow's feet. Many younger patients now use small doses for subtle, natural-looking prevention. Question 4, why do some people look frozen after Botox? This usually happens due to 3 reasons: too much Botox, overtreatment, injecting the wrong muscles, like over-relaxing the forehead, or not customizing doses for natural movement. A skilled injector tailors treatment to preserve some expression while softening wrinkles. Frozen looks are avoidable with proper technique. Always choose an experienced provider. Question 5, can Botox lift hooded eyelids? Slightly. Botox can relax muscles that pull brows down, creating a mild lift. However, it won't fix severely hooded eyelids. For that, surgery, blepharoplasty, may be needed. A Botox brow lift works best for subtle improvements and lasts about 3 to 4 months. It's great for mild sagging but not a replacement for surgical fixes in advanced cases. Question 6, is Botox safe for long-term? Yes. Studies show Botox is safe even after 20+ years of use. Your body fully metabolizes it, and there's no evidence of long-term harm. The only potential issue is mild muscle thinning if overused in the same area for years. Millions of people get Botox annually without problems, just always choose a licensed professional for safety. Question 7, does Botox help migraines? Yes. Botox is FDA approved for chronic migraines. It blocks pain signals by relaxing overactive head and neck muscles. Treatments involve about 30 small injections every 12 weeks. Patients often report fewer headache days. Note, this requires higher doses than cosmetic Botox and must be administered by a trained specialist. Question 8, can you exercise after Botox? Wait for 24 hours. Exercising too soon increases blood flow, which can spread Botox to unwanted areas, like droopy eyelids. Avoid intense workouts, hot yoga, massages, or anything that raises your heart rate. Also, skip lying flat for long periods. This helps prevent migration. After a day, you can resume normal activities. Question 9, what's the baby Botox? Does it work? Baby Botox means using small doses for natural-looking results. It's popular among younger patients or first-timers who want subtle changes. The pros, less risk of looking frozen, more affordable, and good for prevention. The cons, results may fade faster, 2 to 3 months. It's great for maintaining expression while softening early wrinkles. Question 10, can men get Botox? Absolutely. More men are choosing Botox for a refreshed but natural look. The main differences? Men usually need 10 to 20% more units because their facial muscles are stronger. Common areas include forehead lines, frown lines, and jaw slimming, masseter Botox. The goal is often to look less tired while keeping masculine features. Section 2, Fillers, everything you need to know. Now, let's talk about fillers, where the questions get even more interesting. Question 11, how long do fillers last? It depends on the type. Hyaluronic acid fillers, like Juvederm, Restylane, last 6 to 18 months, breaking down naturally. Semi-permanent fillers, Sculptra, Radiesse, stimulate collagen and last 2+ years. Avoid permanent fillers, they're risky and don't adapt as your face ages. Lip fillers fade fastest, 6 to 12 months, due to constant movement. Question 12, do fillers migrate? Yes, especially if overfilled or placed incorrectly. Migration happens when filler moves from its original spot, common in lips and under eyes. Causes include too much product, superficial injections, or rubbing the area too soon. To prevent it, choose an expert, start conservatively, and follow aftercare, no pressure for 2 weeks. Question 13, what's the best filler for under eyes? Thin, soft fillers work best here. Bellotero Balance and Restylane Lift integrate smoothly without puffiness. Avoid thick fillers like Juvederm Voluma, they can look lumpy. The under eye area is delicate, so technique matters more than product. A skilled injector uses tiny amounts and deep placement for natural results. Question 14, can fillers dissolve naturally? Only hyaluronic acid, HA, fillers dissolve fully over time. Your body breaks them down naturally in 6 to 18 months. Semi-permanent fillers, Sculptra, Radiesse, stimulate collagen but don't dissolve, they gradually fade. If you're unhappy with HA fillers, a doctor can dissolve them instantly with hyaluronidase enzyme. Question 15, why do cheek fillers look lumpy? Lumps usually come from incorrect placement, too superficial, overfilling, or using overly thick products. Swelling can also mimic lumps, wait 2 weeks before judging results. To fix it, gentle massage, if advised, or hyaluronidase to dissolve HA fillers. Prevent lumps by choosing an experienced injector and softer fillers. Question 16, are Russian lips safe? Risky. This technique uses vertical injections to create extreme fullness, but it can block blood flow, leading to tissue damage. Safer alternatives include gradual enhancement over multiple sessions with standard techniques. Natural-looking lips last longer and age better than overfilled ones. Question 17, can fillers fix a weak jawline? Yes. Jawline filler adds definition and balance. Products like Juvederm Voluma or Radiesse create structure, while Masseter Botox can slim a wide jaw. It's great for enhancing weak chins or softening jowls. Results last 12 to 18 months and look natural when done properly. Question 18, what's a liquid nose job? A non-surgical nose job uses filler to smooth bumps or lift the tip. Pros, no surgery, minimal downtime. Cons, can't reduce size, temporary, 6 to 18 months, and carries vascular risks. Best for subtle refinements, choose an expert injector to avoid complications. Section 3, risks and safety. Question 19, can fillers cause blindness? Extremely rare, 1 in 1 lakh, but possible if filler blocks an eye artery. High-risk areas, between brows, nose, forehead. Prevention, choose a trained specialist who uses proper technique, cannula, small doses. Never go to unlicensed providers for fillers. Question 20, what's filler fatigue? When overfilled skin stretches, needing more product over time. Signs are puffy face, unnatural proportions. Solution is that you should take breaks between treatments, use collagen stimulators, Sculptra, or switch to surgical options for permanent changes. Question 21, can I dissolve filler at home? No. Only a professional should dissolve filler using hyaluronidase. DIY methods, heat, massage, can cause infections, scarring, or uneven results. If unhappy with filler, see a qualified provider for safe removal. I hope this guide answered all your questions. If it helped, please like and subscribe, it supports the channel. Drop a comment below, what's your biggest worry about Botox or fillers? And remember, always choose a board-certified provider for safe, natural results. Thanks for watching.